Yes. So I connected the headphone, but I did not connect my headless headphone. Yeah, headless headphone. Yes. Actually, I should have introduced the artificial intelligence. 1 second, because it will type everything for us. My conversation. Yes. Artificial intelligence. Continuous 7. Yeah. Oh, now what happened to this? That's fine. $300 left. Yes, get ready, take your notes and keep everything ready. Afterwards, the notes also will be given to you. No need to worry and panic. 916 minutes left. Pro Legacy. 1 day. Okay, fine. Still a lot of time is not used. Okay, right. So here it is. Home. Paste URL meeting. Okay. Yes, Simon's meeting. Right. Artificial intelligence will join now. $921. Simon's autopilot. Yeah. So our artificial intelligence has come and it is recording everything. As you see in Simon's autopilot, it will type everything for us, every sentence that we speak. So try to learn. Yes. Now I have some notes and I'll be explaining number of things. Now, resources of grammar and expression. Resources of grammar and expression. Grammar. You know, grammar is the glamour of English language, or in that matter, any language. Grammar is very, very pivotal. Now, this means how accurately you are speaking, the accuracy part. If your grammar is incorrect, it's a confusion and chaos. The aptness, the correctness, the perfection, the message should pass on to the other person. If you say, I went, if you say, I have gone, what's the difference? Both are finished actions. One is in the past and one is in the present. If you say, I have gone, that means recently. If you say, I went, means sometime back, or yesterday, or a few days ago. It's past. So how accurately you're speaking. For example, you say, he has undergone surgery, or he underwent surgery. But some people write like this, he has underwent surgery. What is this? He has undergone surgery. This is one sentence. He underwent surgery. He has underwent surgery. And some people also say like this, he have underwent surgery. Now see, computer is pointing it out that it's a mistake, because has or have will come with the third form, undergo, underwent, undergone. So undergo, underwent, undergone. This comes from go, went, gone, going, undergone, undergoing. Yeah. So that is how it is. Okay. Lot of important things I'll be telling you now. So go, went, gone, going. Go, V1, went, V2, gone, V3, going, V4. So now these are 1, 2, 3, 4. 1, 2, 3, 4. Okay, verb forms. Same verb but different forms according to different usage. Okay, right. Now, what you are supposed to do is, now this is about grammatical accuracy. Now let us see there. Resources of grammar and expression. The point here is grammatical accuracy. grammatical accuracy. That's grammar and expression. So now here you want to get a grade B. So your target. What is your target? Grade B. That means you need 350 marks. Your score, okay, 350 score. Okay. Now for this, what you need, if you want to achieve this target, what you need, many people don't get 400. There are students who got 450, 460, 470 also. I have shown you some instances. They are there in our Telegram channel. You can check for them. Yeah. B grade, 350 score. In order to get, what you have to do? First one is, number one, you have to improve your grammar. Okay. You have to improve your grammar. Okay. You have to improve your grammar. That means you have to demonstrate. You have to demonstrate excellent command with regard to grammar, grammatical control. You should be perfect. You should play very nicely with your grammatical structures. For example, when you say on admission, that means it is past tense. On admission, it is past tense. He was admitted on so and so date. That means yesterday, day before yesterday. So simple past tense. During hospitalization, that means during this period, for the last 4 days or 1 week or 2 weeks, during hospitalization is present tense. Upon discharge means tomorrow and day after and after 1 week. This is future tense. Future tense. So how you are doing this is very important. It's very important to play efficiently, to use the language structures perfectly. Otherwise, it will be miscommunicated. The message will be misunderstood. Okay, the message will be misunderstood. Now, what you can do? What are the steps you can do is, now you can improve your grammar. Number one, you have to focus on grammar or grammatical structures. You have to focus on grammatical structures. Now, what type of grammatical structures I'll be giving you? I'll be giving you different types of grammatical structures. You have to improve your grammatical structures or grammatical knowledge. You have to focus on grammatical concepts. That is number one. You have to learn the different sentence structures. Okay, you have to learn different sentence structures. That's number two. You have to focus on grammatical concepts. You have to learn the different sentence structures. Now, what are these different sentence structures? For example, you can use a gerund. You can use to infinitive. Now how? Don't confuse both of them. Anywhere you can use. No. Now let me give you one example. Okay. Now, she loves to dance. She loves to dance. He likes to sing. He likes to sing. Now, these are to sing, to dance. These are two infinitives. Two infinitives. He went out to bring some vegetables. He went to the market to purchase some food grains. Okay. So these are to purchase, to buy, like that. To infinitive. And second one is the gerund. Now, what is this gerund? Now, gerund is the ing form. She loves dancing. She loves dancing. Now, to infinitive is an incomplete action. She loves to dance. Did she dance? I don't know. Maybe she did. Maybe she did not. She loves to dance. Okay. She loves to dance. That's the point. Then she loves her dancing. When you say she loves dancing, try to understand. She loves to dance. She loves dancing. There is no problem here. But if you say, now, he stopped. He stopped. They were traveling from Hyderabad to Delhi, from Trivandrum to Delhi. So he's traveling. Now, he stopped. He stopped to eat. He stopped to eat. Try to understand. This is perfect. Now, gerund. He stopped eating. It's not the same. He stopped to eat. That means he's hungry. He stopped to eat. He stopped eating. He stopped eating because his father passed away. He stopped eating. He's not eating anymore. For the last 2 days, he did not eat anything. He stopped eating. So try to understand this one. He stopped to eat and he stopped eating. They're totally poles apart. So don't think that everything every time it is same. It depends on person, place, time, and situation. So learn these and use them on a daily basis. Next. So you have to learn the different sentence structures. There are innumerable scenarios. And you have to familiarize yourself with them. Now, you see, there are innumerable scenarios. And you have to familiarize yourself with them. Now, scenarios, different scenarios. What are the scenarios? What are the conditions? What are the situations? What is the background? A lot of things are there. So all these are scenarios. You have to familiarize yourself with them. Now, what you are supposed to do is, now, you can note down some sentences and practice them on a regular basis. For example, diabetes patient. reluctant patient, adamant patient, impatient patient, lethargic patient. So this is based on the personality of the individual. The next one, angry patient. Angry patient. Okay. There is a patient who has no interest in anything. Okay. That is, they have a distaste. They are not happy with life. They, you can say that they are withdrawn. They lose their interest in life. Okay. They are very sad people. So with those scenarios are different, the settings, the background, children's ward, emergency department, accident, bee stings, coin in the throat, okay, slate pencil in the ear, bleeding from nose, runny nose, varicose veins. These are the problems. They relate to a particular scenario, condition, or situation. So what you have to do is, in this situation, how I should talk. There is another setting of scenario. Introduction. Introduction. What type of sentences I can speak? Conclusion. What type of sentences I can speak? The next, reassurance. What type of sentence I should give? The most common sentence for reassurance is, I reassure you. Do not worry. Is this a sentence, first of all? I reassure you. There is no problem. You are in safe hands. Is this reassurance? Reassurance is not a word. Reassurance is not a word. It's a situational demand. It's a situational demand. Somebody is worried. You're going to give him words of comfort. What are that words of comfort? Of course, you have a severe pain in your stomach. You're not able to bear that one. I'm concerned about your problem. The pain is unbearable. So, now how are you going to comfort him? I'm not going to say that your pain will vanish within no time. This pain will gradually reduce, slowly but steadily. Okay. It doesn't happen overnight. Trust me. Many patients faced this problem. You are not alone. All the patients who had this problem were able to come out of the situation. They have followed the instructions of the doctor and completed the course of action. Because all these people, they were compliant with medication, exercise regimen, and dietary quality. They have been suggested by the dietitian and the physiotherapist and the doctor. All these recommendations were implemented with all their body, mind, and spirit. These people became better sooner. But those who had doubts, they just were lagging behind. So I have seen my aunt, I have seen many patients facing this particular problem. They were able to manage their condition, and within a couple of weeks, they were back to normal and they were leading a normal life. So there is nothing to worry. You are in safe hands. We'll do all the best possible things. So this is called reassurance. Now you should know what is this reassurance. You should know what is this reassurance. Yeah. Reassurance means what? Many people don't know what is reassurance. Reassurance is a C2 vocabulary. Reassurance doesn't mean I reassure you. Reassurance is a word which means you are helping somebody, you are encouraging somebody who is negative mindset, and you are giving them who is upset, worried, tension, full of tension. So you are going to them and you are consoling them. They are filled with grief. You are comforting them, you are pacifying them, you are soothing them. Comfort, pacify, soothe. You'll talk to them patiently, kindly, generously. And you will say, I'm there for you. There is nothing to worry. Many people have overcome this problem. So why not you? Believe me, in a gradual process, your everything will be fine. That's what you're going to tell. That is called reassurance. Words of advice. So you are giving words of advice and words of comfort. Words of advice and words of comfort. Now, what are words of advice and what are words of comfort? Now, advice. What is the advice? This is a very complicated situation. Your weight is beyond the normal limits. If you don't take a precautionary measures, this weight will continue to rise. And then one day, you'll be facing a serious problem. So you have to be very careful. Watch out. Be careful. Okay. So better get up early and get up early to sleep. So these are words of advice. Take your medications regularly. Then the dietitian has recommended the proper diet for you, diabetes diet. Following or implementing his suggestions is expected. We are watching over you. We are monitoring you. Your medication compliance is extremely important. We have come all the way from Delhi to Trivandrum. Okay. Why? So, words of advice, because you are very important. So, no need to worry. Now, words of comfort is the next one. No need to worry. Things will be better. You might have faced many problems like this. You are very strong and you are overcome these problems. Here also we can overcome. So this is called words of comfort. Intended. Intention means purpose. Intention means purpose. What is your intention? What is your purpose to attend this class? To crack OET. To crack OET. Your intention is to make someone feel less worried. He is worried. He is worried. He is worried. When you talk to them, he will become less worried. That's it. Okay. Now, what you are supposed to do is write down these sentences, note down these sentences, and practice them on a regular basis. Now, I have given you a number of sentences. It is already there on the YouTube, and our artificial intelligence is typing them. Okay. I'll give you the author link. You can go there and you can note down those points. Right. Next. So, all this. Now, what you have to do, make a list of these scenarios. Make a list of the situations that you are going to face. Okay. Fingernail. Okay. Brittle. Yellow and brittle fingernails. Or, okay, lack of sleep or oversleeping. Anything is a problem. So, first you will give them the explanation, then you will give them comfort. The next one, we are going to learn number of examples. If you don't know, yeah, of course, no one is a master. So what you can do is you can learn from the others. You can learn from the others. Okay. So you can learn the video, you can watch the videos, you can listen to the audios. Okay. And audios and videos. Okay. So you can learn from the others. They do mistakes. Then you can get the corrections also there. Mistake and correction, both of them. So you will not do that mistake. You will follow the corrections. That is it. Now, there may be many mistakes when you are speaking. We are going to learn some mistakes here. Right. Now, number one. So, some common errors and why they are mistakes. Some common errors and why they are mistakes. And you have to tell me. I'll tell you one by one, which is very, very important. I'll tell you one, these which are very, very important. Why we are not getting 450? Why are many people getting 350? Because we don't use passive voice. Okay. Active voice we use because it is easy. We don't learn passive voice. Be careful. Okay, number one. I will now explain you what caused your condition. Okay, let us take this one as number two. I concerned. Okay, let us take this as it is, no problem. Yeah, now can you write this sentence correctly? There are many ways you can write. This is a wrong sentence. This is not right. Incorrect sentence. Okay. It's correct only. It is correct only. But there is a flaw in that. There is no problem with the sentence actually. There is no problem in this sentence. Okay. I will now explain you what caused your condition. Okay, now can you write how you will explain this? What is this? How to improve this sentence? Okay. I will now explain you what caused your condition. Hmm. Yeah. Yeah, come on, come on, come on. Mistakes are there, but still it's okay. You are trying to do something. You are trying to do something. So here, this can be told in a variety of ways. Okay, now second question, second sentence. I concern about your drinking. I concern about your drinking habit. I concern about your drinking habit. This is number two. This is number two. I concern about your drinking habit. Yes, Dr. Swati, that is right. I concern about your drinking habit. I am concerned about your drinking habit. Next, number three. I recommend she should start her vaccination program as soon as possible. Think about these sentences. I will give you these slides. Write down, learn. Many people will write many different sentences. Okay? Many people will write many different sentences. Many people will write many different sentences. Yeah. So, next. I recommend you need to lose weight. What you can do is you can put number 1 and write your sentence. Number 2 and write your sentence. Number 3, write your sentence. Okay, just take the numbers as they are, which I gave you. Write down the number, write down the number, and write your sentence, whatever it is. Different. We'll take these sentences. We got some sentences, and we'll take these sentences. I suggest you to take the medication as prescribed by your pharmacist. These sentences are correct. These sentences are correct. But there's something more important there. I will now explain you what caused your condition. I concern about your drinking habit. Okay. So some sentences there are wrongs, but some sentences are correct. But still, how to make more quality, bring in quality. I concern about your drinking habit. I am concerned about your drinking habit. Many different varieties you can speak there. I recommend she should start her vaccination program as soon as possible. I recommend you need to lose weight. I suggest you to take the medication as prescribed by your pharmacist. I strongly advise you. I strongly advise that you brush your teeth twice a day. Now you know here, advice ADVICE. ADVICE. Don't think that these are totally mistakes. There are some correct sentences also. Okay. There are some correct sentences, but how to improvise the quality? You can see everywhere I is coming. See, that itself is a flaw. It's a very fatal flaw. Let me give you some advices. Now here, advices will not be there. There is no plural form. Advice, that's all. Okay. It's uncountable. Okay, we'll discuss all these sentences later. We'll discuss all these sentences later. All of you, please participate. Now I have given you 7 sentences. Come on, write. There are only 10 sentences which you have written now. There are 13 students, 12 students, 11 students. One is artificial intelligence and one is I. I'm the second one. And artificial intelligence is the first one. Okay, now we have, but only 10 people have written 10 sentences. How is that possible? I've already given you 7 sentences. All of you try to improve in that particular area. I'm waiting for you people. Write down for each sentence, you write down one sentence. You change your own. I just think that these are not mistakes. Think that these are not mistakes. These are just ideas. Okay. These are just ideas. Right? Yeah. So 12 people have written till now. Come on, think about each, take each point, put the number and write your sentence. Put the number and write your sentence. Yeah, 14. Very good. Participation is there. That's really very good. We are going to learn a lot of things now. These are all important. Even in your writing, you don't understand because of these things only. Some of our staffs were on leave. Some of our staffs were on leave. Some of our staffs were on leave. I have many experience. There is a serious reaction in few children. the condition will recover itself over time. We don't know what cause of this problem. Your condition have worsened. You should to increase your intake of fruit and vegetables. You should to increase your intake of fruit and vegetables. Many people do these mistakes actually. It will helps a lot. You might be painful. He is very expert. You are getting fits for 3 times. You are getting fits for 3 times. Admission confirmed, Deepika. Thank you, dear students. There were some good results. Okay. And these students who got good results, they passed on the information to their friends, and students are joining. So another nurse has joined. With that, the places remaining are only 2 for nurses. And for the doctors, still 2 places are there. Deepika. Deepika. Yeah. VT nursing. Deepika, 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 Deepika. Yeah. The side effects are very minimum. How should I call you? Now, see, let us take the 19th question. How should I call you? How should I call you? If you tell like this, how should I call you? That means there is some sort of, you feel that it is correct. Yeah, it is correct. It is correct. How should I call you? The sentence is correct. The sentence is definitely correct. Now, can anybody tell how you can improve this sentence? How should I call you is absolutely correct sentence. Okay. It is absolutely correct sentence. There is no problem in that. There is no problem in that. Okay. There is absolutely no problem in that. Right? There is absolutely no problem in that. Now, anybody? That's it. Now see, 46 sentences are there. So people started writing. So how should I call you? How should I call you? You can call me loudly. You can call me softly. Okay. You can call me friendly. Anything may be right. How should I call you? You can call me loudly. Answer is right. You can call me softly. Answer is right. Okay. So then, what should you say? This is how should I call you? You should call me with a sign. You can give me a signal. How should I call you? Yeah. You can clap at me also. How should I call you? You can clap at me also. Answer is there. Fine. But the thing is, how to improve this sentence? How to improve this sentence? Come on. How to improve this sentence? Can anyone type this sentence, please? I want to see. May I know your name? My answer is yes. My answer is no. May I know your name? My answer is yes. My answer is no. Dr. Swati. How may I address you? How may I address you? You can tell that. How may I address you? How may I address you? Yeah. What would you prefer to be called? Avil, not preferred. What would you prefer to be called? Called is ed already there. And where is the question mark? Where is the question mark? What would you prefer to be called? Very good. Good, good, good. Write down the sentences. For example, ninth one, I have many experience. Okay. Experience. Uncountable. Here in this case, I have a lot of experience. I have a lot of experience. Then next, Yeah, come on. Write down the answers, some of your answers. Afterwards, we'll discuss these answers. What would you prefer to be called? Could you please tell me your name? Mansi, common spelling Common. Those who write mistakes and I tell them you can write, okay, 10 times and learn the spelling. It's okay. It's okay to write 10 times. There are few side effects for this drug. Kalai, Chelvi, careful. Your condition has deteriorated. Good. Yeah. It must be painful for you. One more student from Nigeria has joined just now. The amount from Nigerian students will go to the orphanage in Nigeria. Thank you all for doing some work. This is God's work, and I thank you. Earlier, there was Jennifer who did this social service activity on behalf of Grand Master class. Another person sent from India to Nigeria recently. Maybe she has joined our classes actually recently, and after joining our classes, she was literally, you know, she was literally in a very difficult situation. Very difficult situation. She cried out her heart, and it melted mine. And I said, "Don't worry, God is with you, and I'm there to support you as far as possible." I told her, whatever you can pay, you pay, no problem. And I don't know, God is using her. God is using her in a different way. She Once she registered with Grandmaster class, after 3 days or 5 days, I think she left to Nigeria. And today she told me, I called her and told her, I need you to do this work because from Nigeria, you cannot bring money here. So what I want you to do is you support like this. You go to an orphanage and distribute this amount to Nigeria. Don't know, God uses people, God has his plans. Thank you. Very good. People are participating. Very nice. Very nice. Okay. More. I'll come out with more. Yeah. See, I had a little bit of discomfort. I had some back pain because continuously from morning 8 o'clock till night 2 o'clock or sometimes 12 o'clock, 2 o'clock, I'll be sitting like this. Early morning, I get up at 4 o'clock. Okay. If I get up at 4 o'clock, I'll sleep at 10 o'clock or 11 o'clock. So 4 hours, 5 hours sleep. Back pain. So I just standing. Maybe people are thinking, why sir is standing? Okay. There are some minor side effects. Yeah, please keep me in your prayers. Nigeria. Justin Onyama. So this is the way how you use sentences. Anything you missed? Hello, Justin Onyama. Yeah, I have sent you the account number. Okay, fine. I'm sorry, I sent it to you. No problem. So this is my trustee. Okay. So a trustworthy person. So they will. I have entrusted the work to them. Okay. They will do the needful. You can just pass the amount into their account. They will do that work which I have told them. Okay. And thank you for your support to help your friend. Okay, dear. Take care. God bless you. Yep. So you don't know. I told this money donate in Nigeria. Immediately, I got another admission, and that is okay. That admission I donated like that. Immediately, I got another admission. I was thinking how to fill up. Already 2 days over. How to fill up these places? I was thinking. I did not ask. One student sent somebody, and she came and directly paid the fees and directly joined. Her name is Deepika. I did not add her in the group even till now. Yeah, just now I added in the December group. Yeah, that's it. So I was literally waiting for these results. Okay. And the test. Now, when we are talking, all these sentences you see, I, I, your, you. So personal pronouns. So you might be painful. You might be experiencing severe pain. Okay. So you might be experiencing severe or intense pain. See the sentence? You might be painful. That is wrong. Okay. It might be painful for you. That's right. You might be painful. You might be experiencing severe pain. You might be experiencing severe pain. Okay. Next. What's happening? My network is, I think, send it to the December nurses group again because I added that new student. Na? Maybe she will join. Deepika's name is there. Na? Now I added OET nursing December group, regular students. Into that one you send again. Right. So, fine. what should I call you as? Or how should I address you? Or how may I address you? Okay. These are some sentences. More, I will tell you later. I'll give you more ideas later. Yeah. Now let us take another point. Okay. So that is one point. Then language functions. Language functions. Language functions. So here you are expressing concern and understanding. Expressing concern and understanding. I know how you must be feeling. I understand your concern. You write your own sentences. I'll be giving my examples. You write your own sentences. I understand how you are feeling. I understand how you feel. I understand why you have this concern. I understand why you are worried about XYZ. Oh, I'm very sorry to hear that. But there is a solution to every problem. Yes, I can see that it must be difficult for you to manage. Come on, first you finish this one, then we'll go to the next one. Yeah, before moving further, I want you to ask, am I over pouring into your brain? Don't pour. Is that a heavy downpour or shall we go ahead, continue? Continue or stop for today? You tell me. You come on, how many of you want to continue? Just type there, because we are getting a lot of points and we are going to discuss practice. This is practice. I'm just taking some materials and I'm giving you practice. Of course, these materials are not that up to the mark. But if you want to learn, come to up to the mark, first you have to practice on these. Then I will give you higher levels. There is absolutely nothing to worry, because this is quite a common problem. I'll give you my sentences later. I'll give you my sentences later. Reassuring the patient. Let me assure you that all the nurses here are experienced and highly trained. Let me reassure you that if we can strictly control his sugar levels within the normal range with proper medications, comma, John will lead a normal life without any troubles. As long as you follow all the advice we have given you, you will make a full recovery. All right, Miss Jancy, try not to worry too much. If you follow my suggestions, David will get much better soon. There is nothing to be alarmed about, because the risk of complications is very low indeed. Avil Narona, Dr. Swati, Geeta Jayakumar, Jackson Kirime, Kalai Chalvi, Mansi, Rajeshwari, Simiat, and Vinita, all are regular students. Really very good. I really feel very happy. And now this number, till now I was waiting. I had a purpose. I had a purpose. Okay. So that's why I did not give admissions for students for the last, say, 4 months. I did not give many admissions. I limited. Okay. I limited the admissions. But now we are going to give more admissions to good number of students. Okay, because it was online, I did not give too many admissions. Now offline admissions, yeah, we are going to start another branch now, most probably in Sri Karyam, Trivandrum. Now we are at Medical College. Okay, we are going to start another branch in Sri Karyam, and pray for us. We are going to discuss the deal tomorrow. It's a 4-floor building. Maybe we'll be taking 1 floor or 2 floors. So pray for us so that we can provide quality study for these things. See here, one student came from Mangalore, is there, from Mangalore. Morning 4 o'clock he got up, mad he is. I told him one day, get up at 4 o'clock and sit down for the test at 5 o'clock. 5 o'clock listening, 6 o'clock reading, 7 o'clock writing, 8 o'clock finish up everything, then go for breakfast, then come back and do the speaking. He's doing that, and now he's still there. Okay. So those who are really struggling hard, is very important for you, for those people who have a desire to clear OET in the first go at the earliest at short notice. For them, offline is the best option. If your friends are there, okay, people, there are many people who want to come, but I did not tell them because I want the people who are really, really, really firefighters. Otherwise, you cannot with me. You cannot. Very difficult. Okay. If you really want, then only you can come and join offline. And you will be doing morning one test and afternoon one test, and afterwards you'll be attending the classes. A very serious, intensive program. So don't think it is ordinary. And people, one day, people will flock and will put the board no admissions. And know that because I have experienced that before when I was in Amritsar. The seats were filled and we said no more admissions, full seats. They told we can take another room, we can take another floor, and I said only I am there. You want me to die or what? Okay. So after Corona, I came back here, but now also they want me to come there. There will be queue. Right. So now reassuring the patient. Okay. Now we have covered 3 areas and 4 more areas are there that we will see tomorrow. Or tomorrow we'll see writing, and day after tomorrow we'll see speaking again. We'll complete that one. So um, yeah. Provide your feedback for this session, please. Yeah. From 4th onwards, all of you make a note. From 4th onwards, okay. What is this? Stop sharing. Yeah. Yes. All the regular students. From 4th onwards, we are going to place one video every day. Okay. There will be premiere. There will be a premiere at exactly 9 o'clock. Exactly 9 o'clock. There will be a premiere from 4th onwards. Okay. Daily one test will be there, and you can take the test directly and you can do the test. The test is I'm actually editing this video. I'm editing this video in Adobe program. So it's here, sorry, share screen. That is here. So everyone, you can attend these sessions. Note this. Complete. Okay. This is the complete video which will be added to the audio. So we are doing like this. This is for your information. Regularly video will be updated every day. And not only one variety, same will be in different varieties. I am going to create videos now. Okay. There are many videos which are confusing the students. Too long answers or confusing situations and demotivated students because of some videos. So I thought, when many people just if they're making videos, why we have so much quality, we have so much standard, why we cannot do it? So I am creating these videos for you people, and here it is. So file, save as, MPG video. Okay. Yeah, I'm just showing you in a flash. This is without audio, okay? Audio will be added. I need somebody, technicians who can do all these things. But people, I appointed some people, but they were not, every time I have to be behind them, poking, come and do, come and do, come and do. Maybe simply I can do it on my own. If I maybe I have to spend 2-3 hours extra. It's okay. So here it is. We got the video, short video, we got it. And yeah. The video will go like this. I have created today all the slides, and tomorrow I have to learn that one, the technique of creating video with audio mixing. So I learn that one and I'll put it tomorrow. So once I learn the technique, then every day I can put one. Yeah. So this is this way how we are going to create. So if you like that one, or if you have some suggestions, you tell me. If you have some suggestions, or if you liked that one, the presentation, how was that one? Was it impressive or effective? Or do you have any suggestions for them? So your suggestions, and whether you are interested to attend one listening every day like that one. And I'll give you the YouTube link, and you can attend the session automatically. You'll get the what's that? Grandmaster class. I'll give you the YouTube link. So you can subscribe there. Share screen. So this is called YouTube handle. Handle. YouTube handle. Okay. This is the YouTube handle. Okay. I'm giving you there. Yeah. So that is a YouTube handle. Just click on that one. Go there, subscribe, press the bell icon so that you can get everything on a regular basis. Every day I'll provide one listening video every day, and I'll try to do my level best as far as possible, because I'm 53 and sometimes age and health may affect me, but still I'll try to do from the best of my knowledge and experience. I'll try to do, because that is what I can do. That is what you want. Okay. So YouTube handle is the same thing. So you can subscribe the YouTube, and then you can just click on that one. There you go. So you can subscribe. Then you can press the bell icon so that whenever there is a premiere, you will know tomorrow at so and so time premiere is there. You will be alerted. Okay. And I will send you the PDF. I'll send you the PDF, and you can print that and keep them in advance. And then you can do that one, and you can take that and send a photo to me. For regular students, I will correct your reading and listening, because you don't know how to correct. There are many students who say every day I'm getting 33, 34, but when they go to the exam, they'll fail. Why? Because you are correcting wrongly. Mistakes, you cannot give marks. You think that because you have written, you think that it is right, but there are many ways it may be proved wrong. So be careful. So we'll meet tomorrow, right? And tomorrow morning we have listening session. Simon sir is going for dinner. Have a nice day. Bye bye.